Hey everyone! Welcome back to UWorld's Next Gen NCLEX review. My name is Nicole, here with another question drill set. Yeah, I said that right. Today's topic is perioperative, so everything before, during, and after a surgical procedure. I think it's mostly things during and a lot of teaching. So I know a couple weeks ago I asked what you guys wanted. So there's a lot of teaching type of questions in these. So this will help you out as well as get some understanding about perioperative type of questions. If you are new here and don't know how a question drill works, is we go over several types of questions. I will read the question out to you, give you about 30 seconds to drop your answers down in the chat. I love to read what you guys think in the chat room. I have it pulled over up here. And then we discuss why the right answers are right and the wrong answers are wrong, so we can get in better practice to answer some of these NCLEX questions and give each other little tidbits and helps as we practice these questions, because the best thing for preparing for the NCLEX is practice, practice, practice. So without further ado, let's get started. Question number 1. The nurse is caring for a client who is receiving moderate sedation during an endoscopy. It would be a priority for the nurse to monitor the client for what? Drop your answers down in the chat. Let me know what you guys think. Is it option 1, bradypnea? Option 2, presence of a gag reflex? Option 3, decreased capillary refill? And option 4, hypoactive bowel sounds. Let me know what you guys think. Hello. Lots of people saying hi. Hi, everyone. It's been a while. I wasn't here last week, so it's nice to see you guys in the chat and already very active. Love that for myself. Hello from Zambia, Miss Helen Mutifia. Sorry if I mispronounced your name, but hello. Lots of highs. Hi, I feel special. Hi, guys. Also, when you're saying hi, let me know what you guys think of this answer choice. What do you think would be something that we need to look out for with moderate sedation? Good answer choices. I think we're on the same consensus here of the correct answer choice, which is option 1, bradypnea. So, priority type of questions, we need to think of what would be the most important. If we could only do one thing to potentially save the client's life, what would be the most important thing to look after, which usually coincides with our ABCs, our airway, breathing, and circulation. So in this case, option 1, bradypnea, would be our number one thing that we're going to be looking out for, especially with moderate sedation. This is something that kind of slows down our respiratory rate and causes us to have respiratory depression, especially if we have a little too much. So the anesthesiologist is watching this very closely. And bradypnea is when our respiratory rate goes below our normal. So this is something that we definitely want to keep an eye out for, and it's our B and our ABCs, breathing. Options 2, 3, and 4 technically wouldn't be our options that we're looking for during or while they're receiving moderate sedation. Option 2, the presence of a gag reflex. This is something that we're going to be monitoring after the procedure and to make sure that they continue and get their gag reflex back so they can swallow safely and breathe safely and all of that. Option 3, this is something that we will assess, but again, we'll assess afterwards. This is maybe option, or like the C in our ABCs, our circulation. So definitely something that we want to pay close attention to, but not ahead or not a priority of breathing or bradypnea. And then option 4, hypoactive bowel sounds. We actually might expect this with a client who is in a procedure because they they probably aren't eating for the previous 8 hours, so they're not digesting or having any of those sounds in their stomach. So this would kind of be expected, and then as well, it's not a priority to be looking after, but you guys did great. So next question. The nurse is observing staff members caring for a client during a surgical procedure. Which of the following actions by a staff member would require the nurse to intervene? Keyword here is intervene. Option 1, the surgeon wipes sweat away from the forehead and continues operating. Option 2, the anesthesia provider completes a timeout before administering general anesthesia. Option 3, the unlicensed assistive personnel counts sponges before suturing begins. And option 4, the circulating nurse provides updates to family members throughout the procedure. Let me know what you guys think in the chat. And then also let me know if there's any recent NCLEX passers or if you scheduled to take your test. I think I saw someone, but the chat goes so fast. So I will shout you out if I can find where it went that someone recently passed their test. Oh, Nurse Treasure, congratulations, you recently passed. That's so exciting. Miss Abere also just recently passed. Congratulations to you guys. That is so exciting. Who else? Who else? Any recent passers? Miss Kalisa on TikTok just scheduled for next week. Good luck. You got this. You are going to do amazing and great. Someone is doing it tomorrow at 8 a.m. Kudos to you for getting one last session, a study session with us today. You're going to do great. You know all the information. Good job. You're going to do awesome. We have lots of next week scheduled for March 14th. Miss Emma Franklin, good luck to you guys. Lots of schedule. We have a lot of people scheduling these next couple weeks and months. I am so excited for you guys to join us in this RN world and that you're still tuning in. So that's so awesome to see. Y'all are going to do great. Great. And then lots of option choices. I'm seeing a lot of 1s and 3s. This is not a select all they'll apply, so it's only one or the other. So think about if you're trying to intervene, we are thinking and looking for something that is wrong, a wrong action. So in this case, we want to do all of these options except for one, which would be actually option 1 as well. So option 1 is our correct answer. The surgeon wipes sweat away from the forehead and continues operating. 1, gross, ew. I don't know about you, but if anyone's sweat gets on me, even if we're not in an operating room, that's kind of gross. But if they're in an operating room and they wipe away their sweat and then continues on, this is breaking sterile field. And this is a huge violation of sterile field and the code. So this would be a hard stop that we would have to stop, re-clean everything, get that surgeon out to re-clean himself. So yeah, this would be something that we would want to intervene and be a good advocate for the patient to prevent any infection. Options 2, 3, and 4. These are all good actions that we want to do and will very likely be seen in the operating room or during a surgical procedure. The anesthesia provider completes a timeout. This is definitely something that we do. The anesthesia and the surgical team both do their own timeouts because we want to make sure that we're keeping everyone safe and making sure the right procedure, the right patient, all the 5 rights are all done with both anesthesia and surgery. Option 3, the unlicensed assistive personnel counts sponges before suturing begins. Again, a correct action that we are going to be experiencing because we don't want to have anything left over in our bodies that was not there before. And yeah, that could be a lawsuit waiting to happen. Option 4, the circulating nurse provides updates to family members throughout the procedure. Again, something that would be expected and hopefully the circulating nurse would actually do just to ease everyone's anxiety as the procedure is going on. So those are all correct answers and things that we wouldn't want to intervene because they're good things to do. But you guys did pretty good on that one. Next question. The nurse is caring for a client in the post-anesthesia care unit, the PACU. The nurse notes that the client has an elevated end-tidal CO2 level and muscle rigidity. Which of the following actions should the nurse take? Select all that apply. So this one is a select all that apply, so there will be more than one right answer. Option 1, monitor the client's heart rate and blood pressure. Option 2, monitor the client's serum potassium level. Option 3, initiate an infusion of warmed IV fluids. Option 4, administer oxygen via nasal cannula. And option 5, administer dantrolene to the client. I had to think about that word for a second. Pharmacology is not my strong suit, or just pronouncing medication names in general is not my strong suit. But let me know what you guys think in the chat room. And then now that we're like almost halfway through the questions, my favorite question to ask is where you guys are all tuning in from. I'd love to see how far UWorld reaches. Is there anyone on from New Jersey? Last week I was at the New Jersey Student Nurse Association and I kept telling them to join us on Thursday. So I want to know if anyone from the New Jersey Student Association conference last week is on today, and everyone else from all over. I see Ohio and Virginia, Ghana, Kentucky. I have to think about that. We got some Texas people in here. Palm Beach, Florida. Oh, you're looking nice in Palm Beach, Florida. Oh, I have someone from Jersey. Yes, she said, yes, I'm from Jersey, but were you at the New Jersey SNA conference? Toronto, Canada, Ghana, Scotland, Pakistan, Massachusetts, Wisconsin, Punjab, India. Someone said the moon. Man, you're out of this world. Just kidding. Maldives. People are on vacationing and studying with us. I am jealous, but thanks for tuning in. Kenya, Kuwait, California, Canada, Tijuana, Mexico. Lots of people from all over. Austin, Texas. That's where I was born and raised. Saudi Arabia. All the people that are posting from like beachy areas, I'm truly jealous of you guys. I wish I could be on the beach right now. Although here in Dallas, Texas, the weather is actually pristine. We have our 1 to 2 week weather of good weather before we go into sweltering heat. So Hawaii on vacation. Yeah, I'm gonna stop looking at the chat because y'all are making me jealous. Yeah, LA, Zimbabwe, Jamaica, must be nice. Correct answer for this one is options 1, 2, and 5. We were looking for options or actions that the nurse should take. So correct course of action for someone who is, we have to figure out what this, I guess, not case study, but what this situation is gearing towards. So a client is in the PACU, the post-anesthesia care unit, and they have an elevated end tidal CO2 and they have muscle rigidity. So we have to think of those 3 factors to figure out what this client could be experiencing. What's their diagnosis? So these are all pointing to what would be considered malignant hyperthermia, which is a rare but a life-threatening situation commonly triggered by anesthesia. And then it causes like an excessive calcium release from the muscles, and it causes those muscles to contract and become really rigid. And if our muscles, like our lungs or our heart, become really rigid, again, a life-threatening situation. So we want to very quickly correct that, which would be stopping the causative agent, which would be the anesthesia. We would try to get that anesthesia out of their system as much as possible and try to relax those muscles, which would be the dantrolene, which is a muscle relaxer, which is option 5. Monitor the client's serum potassium level. This is going to be a correct answer because this potassium levels can rise very quickly in this situation, so we want to make sure that it doesn't cause us to go to arrhythmias with a high potassium level. Monitor the client's heart rate and blood pressure. Again, a correct answer because we need to monitor these clients very closely since they are experiencing a life-threatening situation. Other manifestations of malignant hyperthermia is that muscle rigidity, so in their jaw and neck and extremities, as well as hypotension, which is why we need to monitor their blood pressure and heart rate. Diaphoresis, hypercapnia, which is shown in the elevated CO2 levels. So lots of things that are very life-threatening and can go from bad to worse very, very quickly. But you guys did very, very well on that one. Good job. Oh, the reason why option 3 and 4 are incorrect because option 3, they are already having malignant hyperthermia. They're already really, really warm. We want to cool them down. So we don't want to give them more warmed fluids. We want to give them cooled fluids actually. And then option 4, administer oxygen via nasal cannula. We do want to administer oxygen, but nasal cannula would be a little too tight. We can only go up to 6 liters with that nasal cannula. So we would want to actually give them a bag valve mask oxygen way, so we can give the high concentration of oxygen really quickly. So those are the reasons why those ones are incorrect. Okay, next question. The nurse is preparing to teach a client who is scheduled for an abdominal surgery next week. Which of the following information should the nurse include? Select all that apply. Another select all apply, so more than one right answer. Okay, option 1, these are long, so bear with me. Avoid coughing to minimize the stress placed upon the suture lines after surgery. Option 2, you will be instructed to arrive at the hospital a short time before the scheduled surgery start time. Option 3, you may need to have some diagnostic procedures completed prior to the day of surgery. Option 4, it is important that you follow the instructions of when to stop eating and drinking prior to surgery. And option 5, you will be able to drive yourself home on the day of surgery after spending a short time in the recovery room. Which of these should I include in the plan of care and in the teaching after they are having abdominal surgery, or someone who is scheduled for abdominal surgery? Let me know what you guys think. Lots of great job, great work. I'm scrolling back up, seeing what I missed in the chat. I sometimes get FOMO when y'all talk in the chat and then I can't read and then it starts disappearing. But I'm seeing lots of places from Nigeria, Philippines, Ghana, and then someone was asking about why we're monitoring potassium. We're monitoring potassium on the last question because of the hypermetabolic state, so you hold on to your potassium a little bit more. So we need to make sure that it doesn't go too high to send us into arrhythmias. But for this one, I have lots of answer choices. Pretty much everyone is saying a little bit of everything. I see commonly people are definitely thinking options 3 and 4. Then I get a sprinkling of 2s, sprinklings of 1s. But in general, y'all are doing great. We're getting partial credit on this. That's what I know. We're getting partial credit. And the good thing on the NCLEX, you do get partial credit for the select all that applies. So the correct answer for this is options 2, 3, and 4. So you got that partial credit. Good job, guys. But options 2, 3, and 4 are the correct teaching points that we want to include in our scheduled abdominal surgery. So in most surgical settings, we want the client to arrive earlier, just in case we need to go over lab values, we need to double check things. It's always better to arrive early to your procedure rather than late. That could cause more problems and backlog the rest of the OR. So always come early to your surgical procedure, which is option 2. Option 3, you may need to have some diagnostic procedures completed prior to the day of surgery. Again, this is a correct action. Most times, doctors want to be double checking any lab values, doing any imaging to make sure we get like the correct and most precise and up-to-date information. So these diagnostic procedures would be scheduled just a few days before the actual procedure. So again, a correct teaching point. And then option 4, it is important that you follow instructions of when to stop eating and drinking prior to surgery. This is something that we tell pretty much all of our patients before they go into any procedure, just so we can reduce the risk of aspiration, which can cause even more problems later on if they have extra fluid and stuff in their lungs. So we do not want that. The reason why option 1 is incorrect, because unless it's contraindicated, which is for only certain procedures in certain situations, usually like neuro, craniotomies, tonsillectomies, we actually encourage coughing and deep breathing to help kind of re-expand those lungs. So telling them to avoid coughing for an abdominal surgery actually would be incorrect. We would want to encourage them to do deep breathing and coughing to kind of re-expand those lungs so they don't, so they don't have pneumonia and they, sorry guys, get distracted by everything. Option 5, you will be able to drive yourself home on the day of surgery. This would be an incorrect teaching because if they're getting any type of anesthesia, you wouldn't want them to drive home. This would be a safety thing that we're keeping an eye on. So you would want to have a responsible adult drive you home. So that is the reason why options 1 and 5 are incorrect. But you guys did good. Someone said use a splint after surgery. This is right. Usually they'll give you a pillow to kind of like hug on if you do have to cough or take a deep breath to kind of help breathe and take those deep breaths. But good job, guys. Trying to move over. There we go. Question 5. The nurse is completing a pre-procedure checklist for a client scheduled for surgical repair of the right anterior cruciate ligament. That's just a right ACL for all you people that don't know. ACL, a right ACL. Which of the following findings would require follow-up? The client has an allergy and fall wristband on the right wrist. The surgical consent has not been signed by the healthcare provider. Option 3, the pre-procedure assessment reveals the client has decreased bowel sounds. And option 4, the healthcare provider marked the client's right knee with a permanent marker. Which of the following findings would require follow-up? So if we're saying follow-up, that means something is not right. So look for the incorrect options here. Let me know what you guys think in the chat room. And also be sure to make sure you share and follow us on your favorite social media platforms. I think we got almost 60,000 followers on TikTok. Hey, TikTok. Thanks for joining us there. Make sure to share and follow to all your nursing school classmates, all your friends. We love the bigger the community, the better. Good answers, good answers. Think of what would require follow-up. What is a wrong answer? I like how some of you guys are talking through it in the chat room. And the correct answer is option 2. The surgical consent has not been signed by the healthcare provider. Again, like I said before, there are certain hard stops, which is breaking sterile field in the operating room. But even prior to getting to the operating room, if the surgical consent is not signed by the doctor and by the patient, this is again another hard stop. The consent form needs to be signed by both. And if it's not, this could be considered a battery and cause lots of problems, okay? So make sure to get that consent form signed. Options 1, 3, and 4 are also appropriate and correct actions. You always want to put an allergy and a fall risk, especially since we're going in that right ACL, which is a knee ligament. They're going to be a fall risk since they're not using that knee as well. The pre-procedure assessment reveals the client has decreased bowel sounds. Again, they're usually going to stop eating before the procedure to prevent that aspiration risk. So they're going to have hypoactive bowel sounds because there's nothing to digest. And then option 4, the healthcare provider marks the right knee. This is just signaling that for the client and the healthcare provider that this is the knee that we are operating on and that they are in agreement, and this is the only knee that they can touch. So those are correct options. Next question. The nurse is teaching a client who is scheduled for a bowel resection. Which of the following information should the nurse include? Another, select all that apply. Option 1, incentive spirometry should be performed once per hour when awake following the procedure. Option 2, you may require electrolyte replacement following the procedure. Option 3, discontinue eating solid foods at least 4 hours prior to the procedure. Option 4, a nasogastric tube may be required in the postoperative period. Option 5, strict bed rest will be implemented for 48 hours following the procedure. Let me know what you guys think. Let me know. If you enjoy these question drills, I encourage you to come back every Wednesday and Thursday. This is when we do our question drills. And we're going to stick to our schedule, at least for the time being, on Wednesdays and Thursdays at 11 a.m. Central Time and 3 p.m. Central Time. both for Wednesday and Thursday. So it's not as confusing with different times for different days. So Wednesdays, question drills, and Thursdays, question drills, both at 11 a.m. Central Time and 3 p.m. Central Time. And then Tuesdays, that is when we host our live lectures, and that is at noon Central Time as well. So make sure to tune in and get all the free resources that you can. Take advantage, take advantage. Correct answers for this one is options 1, 2, and 4. Again, so we're going to be looking for correct teaching actions or correct teachings to give to the client that is about to have a bowel resection. Bowel resection is when they take a part of the bowel that is either ischemic or damaged for whatever reason. They take that part out and then they reconnect the good bowels back together. So with this abdominal GI procedure, you may expect to, yes, option 4, have a nasogastric tube after the procedure. This helps with the bowel rest to help decompress any extra air or fluids that is in the bowel still to help kind of suck it back out and rest it for a while. Option 2, you may require electrolyte replacement following the procedure. Again, we took a portion of that bowel out, so absorption and everything will be a little off for a period of time. So we want to encourage that electrolyte replacement either through IV through IV to help keep your levels normal and within the normal range. Option 1, incentive spirometry should be performed once per hour when awake following the procedure. Again, we don't want them to have pneumonia or any lung issues afterwards. So we're going to encourage that deep breathing and coughing to kind of re-expand the lungs and keep them awake as we're usually probably sitting down for longer periods of time and not taking as big a breaths. So that incentive spirometer is a big key thing. Usually doctors really encourage after any procedure. Option 3 and 5 are going to be our incorrect options. Option 3, at least 4 hours prior to the procedure. This would be incorrect because usually the best rule of thumb is 8 hours prior to the procedure. So usually the whole night before a procedure. And then option 5, strict bed rest will be implemented. This is actually not what's going to be happening. We want to encourage them to get up and move around. Again, this is going to help with that re-expansion of the lungs. It might be painful and they might not want to do it, but this is highly encouraged. So we want them to get up and move and get those bowels moving. Good job. Question 7. The nurse is teaching a client about preoperative instructions for a planned outpatient surgical procedure at 0800 the following day. That's 8 o'clock in the morning. Which of the following statements by the client would require follow-up? Option 1, I will eat a light breakfast the morning of my procedure. Option 2, I may require antiemetic medications in the postoperative period. Option 3, I will arrange for my spouse to transport me home following my procedure. And option 4, I understand that I may require a blood transfusion during the procedure. Let me know which one you guys think. Hint, hint, require follow-up. You got to look for these keywords in the question that will direct you which way to go and which answer choices to choose. So require follow-ups. That means something is being wrong. So there's a wrong teaching point here. And what do you guys think that is? Also in the chat, let me know what topics you guys are wanting and needing. Like I said, a couple weeks ago, we saw people asking for teaching or client teaching and prioritization type questions. So we're trying to implement that in any way that we can with the different topics that we have coming up. So let us know what else you guys are going over maybe in your nursing semester right now that you want us to hone in on and focus on. Yeah, we're here to help you as much as we can. Let me know. I see more top priority questions, maternal newborn questions. That's something for Samantha. Samantha's a maternal newborn nurse. Heart failure, comfort care, basic comfort and care and comfort, med surg and pharmacology. So I'm seeing a lot of like basic med surg, general stuff, and the maternal. Pharmacology is usually our number one most ask thing because there's just so many medications that we need to know, which is totally understandable. Good job. Someone asked, how long do you stay online with these questions? We try to aim for 30 minutes. Sometimes we aim a little bit or start a little bit after and go a little bit longer because I like to talk, but try to aim for 30 minutes. The correct answer for this one is option 1. I will eat a light breakfast the morning of my procedure. So again, we're looking for a statement by the client that requires follow-up. So something that the client said that is incorrect, that we wouldn't want them to do. So if a client says, I will eat a light breakfast the morning before my or the morning of my procedure, that would be incorrect. So like I said before in the other question, we want to rest and empty our stomach. So no eating at least 8 hours before a procedure. So we don't have risk for, or we lower the risk for aspiration and then any infection as well. So that would be our correct answer. Options 2, 3, and 4 would be correct things that the client can say that we would be like, okay, yes, you understand and you're ready for your procedure. So these are all good things to do. Last question of the day. The nurses in the intensive care unit is caring for a client who is receiving mechanical ventilation and a continuous infusion of propofol. The nurse should recognize that this medication is administered to what? Option 1, reduce pain. Option 2, induce sedation. Option 3, decrease nausea. And option 4, increase blood pressure. This one's a typical, simple knowledge question. So, what is propofol used for? Let me know what you guys think in the chat. And also let me know how well you guys did today out of 8 questions. Do we have any 100%ers? The smart people that are so ready to take their NCLEX very soon? Let me know what you guys think. I think we have a good general consensus on this answer or question. I don't think I've seen any wrong answers so far in the chat because the right answer is option 2, induced sedation. Propofol is a medication, it's an anesthetic medication for procedural sedation, but you also see it in the ICU to do induced sedation while on a mechanical ventilator. But you guys did great. All the other options, no need to go over because that's not what propofol does. So yeah, good job. I hope you enjoyed and learned something new today. Thank you guys so much for tuning in. Like I said, let us know how much out of 8 you got in the chat, and I would love to give you a shout out next week. But see you guys next week, Tuesday, Wednesday, Thursday, lecture and question drills. Bye. Have a